She's a mom. She has 2 kids. She doesn't have years time for braces to get her teeth ground down and all the other choices. We see professionals from all different backgrounds to get optimized to advance their careers and to advance their social life. It's all about how you present yourself. It only takes 2 visits that last about 4 days. Her life changed dramatically. Her entire face, misaligned jaw, underbite, and crossbite have been corrected without drilling down her teeth. No shots, no surgery, no aligners, no braces. My method is safer. It's faster. It's quicker. It's more predictable because we can test it before we do anything to you than any other method I know of. Face Lift Dentistry costs more because we're doing more. It's far more complex than just putting 6 porcelain veneers and having a better smile. This may be the highest level of healthcare that is combined with the highest level of cosmetic benefits that are above and beyond veneers. One patient said, when you realize all the benefits, getting it is cheap. Now, he said that because he could afford it. Well, many patients we see want it but can't afford it, and it's because all the teeth have to be treated in order to correct your bite, your jawline, and support your face. It's not just 6 teeth in the front. Let's look at another underbite case. If he got veneers, his smile would look a little better from the front view, but his large poked out chin and his large, his profile would be exactly the same. In order to improve his facial profile and his protruding chin, he needed his underbite and crossbite corrected with the Face Lift Dentistry method. Look at the shape of his face and his chin and his jawline. This method improves the quality of your life with every person you meet. Our seniors are faced with facial collapse, and they have their teeth worn down and a class 2 deep overbite. Veneers can't reverse facial collapse. Look at his face in the before photo. His face makes him look older because of his bite. His face is short, it's round, his lips are squeezed together with a sinking chin and jawline. Welcome to growing old. When you look in the mirror and look at your face and realize something is happening to you and you don't know why, chances are very high it's your bite. This is typical of my 60-year-old patients. Face Lift Dentistry was designed to improve the shape of your entire face by only working on your teeth. And when he gets his bite aligned and optimized with his jaw joints, Temp TMJ, the results are vastly improved jawline. Just look at how he gained facial support. He feels great about himself because he looks younger. Look at the facial proportioning. He can breathe better. He sleeps better. He speaks his words more clearly. There's more room for his tongue in there. He will present himself far better with every single day, in every single circumstance. And he says it's worth it. Young people, they don't like their facial profiles, small chins. She gets headaches. She has a deep overbite, which causes her chin to be pushed back and closed too far. Porcelain veneers can't help her. Face Lift Dentistry does what veneers can't do. When your bite is optimized to your jaw, it's good for you physically, mentally, and cosmetically. This method goes beyond a smile as we're trying to improve the quality of your life. We don't just give you a better smile. This method improves your life. We call this, as we said before, getting optimized. Underbites, crossbites, misaligned jaws. She can't speak her words clearly. Look at her video on the website. She flew in from another country in Europe to get this method because it's only available in Santa Monica, California. She went to bite reconstruction, TMJ specialists, oral surgeons, orthodontic specialists from all over the world, multiple countries. Every one of them said jaw surgery is her only choice. Well, jaw surgery is no longer your only choice. Her treatment was completed without shots, no drilling, no jaw surgery, and it was done in about a month. A month. We see patients from all over the world that come to Santa Monica for this treatment because it probably is the highest level of non-invasive dental health care with cosmetic benefits in the world today. What can I say? Young man with a posterior open bite. He's biting his teeth together and none of his back teeth touch. So earlier you saw an anterior open bite. This is a posterior open bite. He has a posterior open bite, which means none of his teeth touch. And imagine trying to eat when none of your back teeth touch. His chin is in the wrong position. His teeth are too small for his bone structure. If he had jaw surgery and braces, his teeth would still be too small for his facial anatomy. So those treatments can be limited. They do great things sometimes, but a lot of times you don't need them. The advantage to this method is instead of cutting your jaws surgically with braces to make your teeth fit, we improve the shape, sizes, color, and angles of your teeth to fit the jaws that you already have. Did you understand that? What I just said was, instead of surgically redesigning your jaw, we non-invasively redesign the shapes of your teeth. It's incredible. And so here's our last patient. She's growing a little older. She has some facial collapse. She has straight teeth. She looks older than she should. She has a sinking jawline that is typical of seniors. We call this premature aging. She has the wrong bite for her facial structure. We redesigned the shapes of her teeth, and we were reversing the impact of aging at the source with anti-aging face lift dentistry. Patients say they're sleeping better and breathing better because their new jaw position, which is downward and forward, gave their tongue more room to work. As you age, there usually is less room for your tongue because your teeth are wearing down. People say, how do you move the jaw? Shh. It's quick, it's painless, and it's a secret. And we can do it in a matter of seconds. We test for success before we do any treatment to your teeth. So it doesn't get any better than that. Look at the shape of her face in the before and after photo as she's biting her teeth together and smiling. She has a sinking jawline, a sinking jawline because as you age, your teeth wear down. Your back teeth can be impacted. Your breathing can be impacted. So you feel old. And when you feel old, you look old. I don't care if you had a facelift and porcelain veneers, you look old. If you want to look younger than most people your age, and you kind of want to rub it in a little bit, get anti-aging facelift dentistry and rub it in. It's the way to do it because your entire face gets supported. If you want to improve your health, have better breathing, better sleeping, less tongue issues, gain facial support, improve your facial profile and your posture, and change your life, I have the method that can help do some of that, maybe all of that. It's quicker, safer, and more predictable. My name is Dr. Sam Muslin, and I invented the facelift dentistry method because I had to. So call our office and let's get started.